Good evening, everybody. It is Monday. It's the 16th of May, and you're here at Neuro at Night. Tonight we have a guest speaker, but our guest speaker is someone who attends a lot of our lunch and learns at Neuro at Nights and has, brought maps to us before and other cases and contributes to the discussion. Dr. Cassandra White, out of the western part of Canada. And she's going to be talking to us tonight about autism, and she's got several maps of clients she's worked with and going to be looking at some pre-post changes. So, Cassandra, we thank you so much for being with us this evening. We know you're a busy person as well. So the show's all yours, and I'll give you a 10-minute warning right about 10 to the hour if you want to do any questions and answers.
Yeah, thank you, Rob.
You bet.
So I just wanted to say, so I'm a psychologist. We have a pediatric clinic in Calgary, Alberta, and so at our clinic we do counseling, we do assessment, and we do neurofeedback. So most of our clients that come in know us already if we're going to be doing neurofeedback with them. So I would say that I feel like I'm an expert in developmental things and psychology, and I am less of an expert than the rest of these panelists with neurofeedback. Tonight's talk came about because Judy was asking about autism, and I was just sharing some of my thoughts. And so I have a couple of cases to talk about tonight, and three, I guess. And one of the things that, as I was looking through these, it was just a reminder of how tricky autism can be, because we're dealing with a lot of different things, like kids with sensory sensitivities, and all the different things that they can be struggling with, which are the reasons that they would be coming to us. So this first map that I have up here is a young person that just finished their training. In our clinic, we do a brain map, and then we do 20 sessions, and then we do another brain map. And in those 20 sessions, we do set goals, and we also do some strategies and things to help them with their goals. So this young lady had a nice change in her map of 48% towards normalization, which I think is pretty good. I don't know if anybody else, Judy, Rob, Richard, anybody got anything to say about that?
That's very good.
Very good.
Yeah. The first one.
We were happy with it, and more than that, this was her eyes open map. And what was interesting with her, maybe we'll just go down here, and I'd love to hear anything that Judy, Rob, Richard, that you have to say about the things that stand out to you guys here. What I'm noticing is that we get a change in the interconnectivity. And so I'll just, well, actually, I'm seeing lots of different things. Sometimes we get that change in the magnitude. This one's not showing as much.
You got some decent change in the dominant frequency, though. That was good.
I'll just go back up here. Magnitude. And did I miss my?
Yeah, dominant frequency. Yeah. Looking at the slider bars. Yeah.
Yeah. Yeah, and we've got, if we look at alpha there and some in theta,
yep.
A little bit in the back in delta. And then we've got this interconnectivity, and we're seeing more in beta.
Good for memory.
Yeah. Mm-hmm. Yeah. And what this young lady, she is 16, I think, and she herself said that her comment was, "This changed my life," which was neat to hear. And her teachers happened to catch her mom and said, she's more engaged at school. She's seems to be more present. And that was one of the things that we were working on, was just sort of awareness of her surroundings and paying attention to them. She used to be very much in her head. And so we're seeing some of those changes, but there's still other things that, still more changes that could happen.
Is she Asperger's? Is that what you're saying?
Yeah, she would be more
High functioning Asperger's, or?
Yeah. I mean, she was really able to express a lot. But what we did notice is she really struggled with, like, even doing her own ratings on her goals. But they were kind of all over the place, and so I'm not going to show the progress charts, because what we discovered is she really she didn't have enough sort of personal insight to be able to, she kind of ranked everything a 5 at the beginning, because, well, that was right in the middle, and she didn't really have an internal sense of how to evaluate herself and what was going on. So some things by her ratings looked worse at the end, but I think it was actually that she was more in tune at the end with what was actually happening, and better able to give an actual rating. So that was interesting.
Yeah, well, you can see that the temporal lobes were pretty disconnected in the pre-map, and they're much better in the post, which means that she has more access to emotional valencing.
And memory. Look at the F7, F8 areas improved. You got some memory issues there as well that improves. Yeah, good stuff.
And I think, if I remember correctly, actually, now that you bring up memory, Rob, I think that she would say that things were going better for her at school. She used to be so anxious that really just like being in the building all day was very stressful for her. And so she couldn't remember anything when it came to a test. So, I mean, we're still seeing the beta there in the asymmetry, but
one second. Can you bring the asymmetry up a touch and get them on both? Because I am like so struck by this first one. This is such the head trauma picture that this shows, with all the lateralization that's going on in the first map. So it's, whoa. Do we know anything about that? Because
they didn't report any. I mean, we always ask, and no report of that.
So it's like it should be copied as like a textbook look. It's so perfect.
Mm-hmm.
And nice change though in the second map in this way.
Yeah.
So anxiety is improving.
And we can, and she would say that, and it's interesting that her mom happened to, just the day that I was doing that, sharing the map results with her mom, she said, oh yeah, I ran into the teacher, and that the teachers are noticing, and they didn't know anything about this going on. It's high school, like teachers aren't really all that involved. So so this is her eyes open map, and now I just have to see if I can find her eyes closed map here.
Yeah, it helps if we start with the eyes closed. If you do more maps.
Let's see. It's open. It's closed. I was fiddling trying to figure out where to find all the maps. So sorry. So
that's it.
Yeah. Can you guys see it?
Yes.
Yeah, can we see the head map for a sec? I went through that pretty quick. I can't read maps that fast.
I'll just go down to the head maps here.
Okay, so that's the eyes closed. You can see there's a bit of delta in the back, huh? And the and in the right temporal region, that's delta and theta. So there's that's a lack of connectivity, on the right side with emotional processing. That delta in the back on the right side will help, will impact their ability to read people's faces. body language, you know, because the parietal region and the posterior temporal parietal junction, those are facial encoding and body language interpretation areas. And then the right temporal lobe in that region in there is often involved in being able to listen to intonations in people's voices and decode the tones.
Yeah, which we would expect to see that in somebody with that diagnosis. But it's interesting that there it is.
Yeah, and it is in the back. So I mean, Judy's right. You know, this when you see the eyes closed, this is like, it almost looks like she had a head trauma. Like a posterior alpha is really elevated with the eyes closed, and that usually is related to people really kind of being perseverant, and having a lot of
That's definitely a lot.
mind chatter.
Yeah, that was huge for her. The mind chatter, the perseverating, getting stuck on thoughts, especially at night, but all day long, really. And I think that she would say that improved. So, yeah.
That's great. And she has some beta that's elevated that's independent to some degree of the high beta. So she looks like she really does have some anterior and posterior cingulate beta that's overactive. So that would affect, make her attention so that she would have difficulty settling her attention on one thing.
Yes. And that was actually one of the things that we tracked. She is still struggling with that, but her report is that it did get better over the course of the 20 sessions, that it was improved. And I think that her mom also reported that too in her ratings, because she was because it was difficult for her to rate herself. We also had her mom do some ratings too.
Oh, yeah.
Where did you train? And do you know offhand the protocol you used?
I'd have to look that up. I don't remember off the top of my head.
Okay.
We were doing, I'm trying to remember if we were doing frontal. Yeah, I can stop my share and look it up if you'd like, Judy.
That's okay. No, that's fine. We can keep going.
Yeah.
I was curious if you knew.
I'm curious how she sleeps. My best guess is she's still not sleeping well.
She's not, and that was a piece that we did ask about. And she's still not, you're right, she's still not sleeping great, but it did get better than it was, because she would just sort of ruminate.
And we've got to keep in mind that you have this is 20 sessions in, right?
Yeah.
Which is nothing. That's just the beginning. So you've done well with 20 sessions.
Yeah, and they were so happy. They're just waiting for some funding to renew. So they're going to come back probably at the end of the year to do another 20 sessions.
Great.
Yeah, they did feel like it made a difference. So but we're still seeing some of those same asymmetry patterns that we saw before.
Yeah.
Very strong coherence issues too.
Yeah.
No, the pre-post eyes closed didn't get much better on the beta asymmetry is the same.
Yeah. That's interesting, isn't it? That it got better with eyes open, which I don't understand that. I don't understand why it would be better eyes open than eyes closed.
If I had to put a guess to it, Cassandra, and Judy and Richard will chime in, it might be because she's getting more comfortable being in school, because she's succeeding a bit better, so the anxiety goes down. I always think of the eyes closed as their internal world, how they deal with themselves, and their eyes open is how they relate to the world around them. So the fact that she's doing better in school and we saw some shift is good.
Yeah.
And there was some change in connectivity with her eyes closed. And
there
so
was. There was good improvement there. Yeah, there was good improvement.
Decent improvement in there, even though there were some areas that, like posterior alpha, sped up a little bit, but in delta and theta, there was some calming around the busy mind stuff. So that offered her an opportunity to maybe, even though you trained frontal, you got some nice.
We did do some
lowering.
training back as well. I just can't remember if it was P3, P4, or 01, 02.
Yeah. And
Yeah.
so it was eyes open probably. And that's why we maybe saw that asymmetry start to shift.
Yeah.
With eyes open.
Hmm.
But you know, I don't know how you ask the question around this, but there's head trauma in this history, whether as a little kid she banged her head, maybe was she a wall hitter, you know, or something. There's something, but that's just too perfect.
Mm-hmm.
What are you referring to, Judy?
The lateralized, like all blue on left, all blue on left, all blue on left.
Okay.
Eyes open.
Yeah.
Yeah, generally speaking, when we see those, Cassandra, we think in terms of explore more about possible head injury, because it's a pretty common pattern when people have had head injuries. So that's what we always ask. And I think you've got my head injury checklist. You might give that to the parents. Yeah.
Yeah, this was an interesting case because she and her mom both came in to do training at this. They did it as sort of a duo. So they both have the experience, and it was really great because they both got to experience the changes. The mom knew kind of from her own training what the daughter was going through, so they shared that. It was really neat to have them both do training at the same time. So that's that one. Now let me just.
Can you speak for a minute in general about some of the specialized needs that you take into account when you work with autistic families, and not just the children, but the families? Because the ones that come in my office, I mean, honestly, prior to doing neurofeedback, I had no experience with autistic families or children or anybody on the spectrum really that I was aware of. And now, as I mean, a lot of my families know a lot more about all the different aspects that have to be paid attention to, but yet some of the families totally ignore things like diet and and I find
that's actually a really good point with the diet. So I would say for people on the autism spectrum, they can have real big food sensitivities and aversions. So like I've met kids where they just don't eat anything but chicken McNuggets, and because they have texture sensitivities, and or they really, really struggle with cognitive flexibility. So they just kind of will only eat one thing, and they, you know, it's really difficult to get them to try anything else. So a lot of them that I've, not all of them, of course, but it's common that there's going to be issues around eating. Like there might only be a couple foods that they eat. Sleeping is a regular issue for a lot of the kids. When we're doing training, that sensory sensitivity. So sometimes we have to even work up to being able, like having their head touched. I don't know if you've had any of those in your clinic, Judy, but we've had kids where we had to just start off with helping them to be okay with people touching their head, and sensitize that first. Or we've also had kids where they just couldn't cope with the feeling of the paste or when we were mapping. That can be really hard for them to sit in the chair for the map. We've got one little guy right now where we decided we'd map after 10 sessions because we just could not get the map done.
Yeah, well, that's really common.
Yeah.
We've sometimes sent ear clips home. And we've said, play with these and go get a bathing cap.
Exactly. Yeah. Or because we're in Canada, you know, get them used to wearing a tight toque or for the winter. So they're used to having something on their head that's tighter. Yeah, absolutely. And the other things that just in terms of the training, you know, there's things like the lighting in the room or that is an issue. We've had some kids where, because routine can be so important. So we have a pretty, especially for some kids, a really regular routine. We often have them come in and we'll do some HRV for 5 minutes, and then we do their training, and then we might do, for the last bit of the session, we'll do something that's related to their goals, whether that's practicing something with them, or like for our kids on the spectrum, it might be having a conversation on something different than their favorite topic, those kinds of things. And we keep to that routine for these guys because it can really help things to go better. But for some of them, it's quite interesting. Like we had one guy where we said to him, we're going to do the training for 20 minutes. And then it was really hard for him when we wanted to stretch it to be longer because he's like, no, it's 20 minutes. That's it. Yep. You don't get more than that.
Right. That's funny.
Yeah. And so we have to also be kind of aware of what we, in our minds, we're like, okay, we'll start with 20 and we're going to work up to 30. But with him, it was a real struggle because it was set as 20 and that's how it was going to be forevermore. He was going to go eat Chinese food before he came, unfortunately. And then he was going to do his training. And so it was hard to break some of his habits. But eventually, I think we were able to work that out with him as he's trained more. Actually, I think, yes, he's the one, actually, the map that we're looking at now. This kid is 10 and he has done probably 60 sessions. So I've got 2 sets of maps for him. This is his first now. Let me just see, is this his eyes open or eyes closed? Let me just check. Sorry if I picked the wrong one. I was just trying to, this is his eyes open. Let's see if I can get to his eyes closed. There we go. Sorry that there's still names on here. I would have liked to have taken those off. So this is his eyes closed.
Oh, that's much better. In his eyes closed, he's got 46% change and 41% normalization. It's a big change.
Yeah, and this was the first map, and his second map was also, just to let the cat out of the bag, was also 41% eyes closed. So, so that was something I was wondering from you guys. Do you see less change when they've been training longer?
For some people, that's not uncommon, that they have less, kind of less room to adapt as they reorganize more and more. But it's not universal because everybody's situation is slightly different. But it's a fairly common pattern that we've seen with people.
Yeah, Sandra and I, if you map somebody and then you do a comparison, then you run more sessions and compare the second to the third, then the numbers may be down compared to the first comparison. But if you go first to third, sometimes you see some amazing looking differences.
Well, and this one is interesting because, this is the first to the second eyes closed, and it was 41%. But even the second to the third was also 41% eyes closed.
Yeah, which is amazing. Yeah.
I think it also depends on, some of them are watching their food more closely. And, I know that sometimes you can't because they'll only eat 1 or 2 things. But when the families are taking more, getting more supplements in, and the change will then, I've had change keep on happening. And, I always say I never know when it's going to, so to speak, max out, and we'll just keep going for a while as long as we're getting somewhere.
Yeah, they will be coming back. So I was just wanted to point out some of the changes in the magnitude here in theta in particular, which was nice to see in this first map.
Posterior delta, you got some good changes too.
Yeah.
And this is a little guy where his we're noticing that he was more flexible at school, more flexible at home too, in terms of he would really, really struggle if anybody did anything that wasn't the way that he wanted it. So if they said things that he didn't like, if they didn't act in the way that he was expecting, he really struggled. So here's a nice.
Did his sleep get any better? Do you know?
I think that they said that it had, I mean, he also struggles significantly with sleep. But if I remember correctly, it used to be that he needed to have I think one of his parents laying down with him, and he's now more able to sleep independently.
Okay. Yeah.
So still not great, but I think it's been getting better. But here's some of the interconnectivity, and this is kind of the things that I'm noticing as I look at the maps, is that we've got some nice changes in the interconnectivity starting. So I don't know if you guys normally see that with kids who present this way, but they make sense to me that the interconnectivity would be starting to get better if we're seeing changes in their behavior.
Yeah, the ventral stream is improved, and with that, typically are improvements with emotion and emotional, content and reaction and memory. So that's what I would have guessed you'd tell us.
And I'll see if I can get the asymmetries here.
Oh, look, there's another head trauma patterning.
Yeah, only it reversed itself.
1 second, is that asymmetry on the bottom here?
Yeah.
Yep.
Wow, so look at how it reversed.
Yeah.
That's really unusual.
It is.
Like
the brain's reorganizing,
Yeah.
Big time.
Yeah, that's a lot of change.
Anxiety went down, and he got a little more moody or sad or depressed.
Yeah, you know what? I think that makes sense with what we know about him. And I guess, and I don't remember if this is something that we've talked about, Rob, but when that anxiety coming down, I kind of took it as him being a little bit more aware of the world.
Yeah.
Like so anxious before that he couldn't really take it all in. And then, yeah, it seemed to me that he was more aware of what was going on.
Well, with that comes sometimes some emotional upset about realizing your status more.
Yes, and I think that is, really fits, that he was kind of becoming more aware of the world around him and how others perceived him.
Yeah, I've seen that with kids with autism when you're training. That's often an important phase they go through.
Yeah. I'm gonna we'll stick with the eyes. Do you want to see the next eyes closed map that we did after this one, or do you want to see the eyes open?
Well, it's nice to see the eyes open and compare the eyes open to the eyes closed. Both maps are important to make a sense of what's going on.
Because this one was sort of mysterious to me. I mean, there wasn't a whole lot of normalization, but there was a ton of reorganization, which isn't always bad.
I wasn't sure how to interpret that, because that is a lot of reorganization, and I've heard people say that's
I had the same percentages the other day with a home unit person who had done a lot of intense work and very soon after came in, and I chalk it up to the brain is utilizing the information we've provided, and it's not kind of settled yet, and we should in like another month or 6 weeks see.
Oh, hold on to that thought, Judy, when I show you the next map.
Okay, because that's what I'm, because it's hard when you see this low normalization. This map, the other map with my 11-year-old girl on the spectrum had a 40 actually plasticity, but that's what I told the mom, and they wanted to continue, so we'll see more. But I also slowed up how many sessions they were doing a week. With the home unit, I just told them, don't do it every day. Do it 4 or 5 times a week. Let her pick the days off for some autonomy.
Yeah. So this is the eyes open.
Is this a new person?
No, this is one.
This is that the eyes closed maps, eyes open.
Yeah. Well,
Really?
Now this looks like there could have been a head injury that possibly occurred while you were training, which would have explained some of that pattern we saw where it went from a shift or some major inflammation. Wow.
something happened in the course of the training.
And what makes you say that?
The dramatic change in delta and theta.
Yeah.
Yeah.
All that slowing.
And beta. Look at, but the
Oh,
beta could be muscle tension, but the beta went up as well.
The delta and theta could also be related to sleep as it increases. But we've also seen primitive reflexes have a real effect on delta too. So it starts to get you wondering how many of these kids with autism and Asperger's have primitive reflex issues. And my understanding is it's pretty common.
That was very eye-opening, that talk.
Yeah, it was, wasn't it?
I wasn't able to. I'm gonna have to listen.
It's already posted. It's already posted. You definitely need to look at it.
Yeah.
Definitely. You would appreciate a lot of this because it's accounting for different mechanisms to get this delta down and the changes that occur quite rapidly from what he was describing.
Great connectivity improvement. Look at that.
Yeah. So this is what I mean by this is the pattern that I'm noticing, is that's kind
You're
of
getting that ventral stream just out of the lows and getting more normal.
Yeah, F7, F8, T3, T4, T5, T6, as they improve emotional awareness and regulation starts to improve, but you don't get the real regulation component of it until you're working on the frontal lobes, FP1, FP2 with these kids.
I don't know if you can see both of those. There we go.
Yeah. And what's interesting there is, the top one is pretty mixed, but the bottom one looks more like that right dominant pattern that Judy was talking about in the eyes closed map, which again makes me wonder with the elevations, in addition to poor sleep, that could also be a result of, does he play sports? Did he get hit in the head somehow?
Not at all. He's definitely not a sports kid.
But he might have fallen. He could have taken a good trip.
Good spill. Yeah.
I don't remember if, I don't know if he was sick or anything like that during this time.
Sometimes these falls, I think people, they don't even pay attention. Like he got up and kept going, and so we just didn't even think about it.
Yeah.
I think you're right, Judy.
So this is the second to the third map. Eyes closed. So there's the 41%. And I'll just go down to the map part here.
Good improvements in dominant frequency. That looked really good. The slider bars in dominant frequency got improvement in all areas. Nice.
Yeah, they came up nice. You're right, Rob. The alpha still needs to come up, though, doesn't it?
Yeah.
Whoa, look at that asymmetry change. Like the total flip again, that flip.
So here's the magnitude.
Yeah, I got some good improvements in beta, which is nice. That means the brain's got more energy.
Yeah. Actually, now that you say that, I think he's getting through his school day better without being so tired.
Yeah.
And then the dominant frequency.
He's still got really slow alpha, which...
Yeah. Still not sleeping great.
Yeah. I think his parents would say that too. But we've got, there's the...
Now that's odd. Look at that. The connectivity really dropped down in a lot of areas and got a lot lower.
Yeah, it came down. It's good. I mean, that's showing better coordination and function between the hemispheres, which is a really good sign. Because when that improves, it also usually means that the connectivity between the cortex and the limbic structures are improving.
So what do you make of the ventral stream slowing back up?
I think it's just an adjustment.
Mm-hmm.
It'll come around, come back to normal. A lot of times when things start to normalize, they go farther in the opposite direction than you expect. And people used to say things like, "Oh, that's overtraining," and it's not. It's, you know, now that we're 20 years with neuroimaging, we know we should know that's not it. That the brain is so complex that it has to go to extremes sometimes as it reorganizes. You know, it's just like we always say, you know, like it's like bringing new furniture into your living room and reorganizing the living room. You know, it's too much furniture and stuff slammed against the wall or halfway out the door or out the window as you're trying to get everything organized. Things look worse a lot of times before they get better.
Sometimes I feel like these kids that are on the autism spectrum are here to remind us of that everything's not so linear in how it's going to go.
Yeah.
Unexpected things happen.
Healing in the human body is not linear. It never has been. You know, if you ever had a major operation, you know that. You have good days and bad days as you heal.
And this asymmetry, it's like the reverse happened again, only it went from all left dominant and more depression to the kid appears to have a little more anxiety now.
Yeah. I'm just looking. It looks like I want to show you the eyes open map because that's why I said, Judy, to hold on to that thought about that because it was like 25 or 27% change.
Yeah.
I'm just looking at maybe I don't know if I have it all. Oh, hold on. Oh, I'll look for it because it's the eyes open from the second to the third map was a 60% change.
Oh,
so
yeah. Right.
I'm just looking for where I have that one. So I'll have to find it.
Are you just using the protocols that are the map is putting out?
Yeah.
Is that what?
Yeah.
There's Rob's theory. Well, that I just use what's on the map half the time, and it works really well. It does.
Yeah, absolutely.
I mean, they're all meant to be suggestions and not written in stone, but they seem to be generally good suggestions. Well, they're probably.
Yeah. I would say the majority of time, Richard, that the map generated protocols are good suggestions and work well.
One of the things that I found with all these kids with autism is that when you train them, I always finished up training them at FP1, FP2, and I would get really good synchrony and language improvements. So you get this emotional synchrony back and forth and much better language.
I lost your screen.
Yeah, I was just I stopped showing it to see if I could find that other map. So I'll just see if I can find it for you. But that's interesting, Richard, because we often FP1, FP2 is often recommended for the population of people that we see, but we struggle so often with it because of
tolerance, placement, movement.
Exactly, and all the tension.
Putting the words in your mouth, but that's the same thing. It's like, oh, I want to wiggle my eyebrows all the time because this thing is.
Or they want to watch something that they're really interested in, but then they get, we try to make it, interesting but not so interesting, but then they will move their forehead or there's tension, and we just find it really a struggle.
Well, that's because you're expecting they're going to get a clean signal up front, which with these kids you never do. But we've had at least a dozen kids with autism and Asperger's, especially the autistic kids, where it just looks like a mess while they're training. but they still get massive improvements training in those locations in spite of all the artifact, and that's undeniable. I mean, it's
I've had similar experiences, Richard. I had one kid, and his EMG at FP1, FP2 was up in the 30s and the 40s, and I'm watching this kid, Cassandra, and he is sitting perfectly still.
That's what we're finding.
I called the mother in and I said, "Can you just keep an eye on him?" And I'm getting this artifact, but it looks like we both said he's sitting perfectly still. I said, "Would you get him checked by someone who does like physical therapy or whatever?" And she had a friend who did it, and they found out it was his posture. So when he sat in the chair, his posture was such it just caused his muscles to go right up his neck, over his scalp to his forehead.
Yeah.
Wow.
He trained beautifully anyway, like Richard's saying. He trained well. He made good progress. But boy, that was like, whew.
I think the hardest thing is for me to tolerate looking at the crummy looking training. It's like, oh, I'm not doing my job. The training is, that's, but I've been trying to tolerate it because Richard has said it before. Even if it doesn't look so good, keep going. Keep going.
It tends to improve over time. It gets better, they get quieter and they get better. The one problem with training, you can't train frontally too much in a row because then they get, their arousal level starts to get too high. So we often have to go back and train more in the back somewhere. And usually I would go back to C3, C4, and that would calm them down a lot. And then go back up front, train a little bit more. So it's kind of front and back, because if you do just train frontally, they tend to get a little overactive at home and school.
So here's the eyes open second to third map. So between the first and second, we only had a 25% change. But the second to the third, we had a 60% change.
Yeah.
And the reorg went down.
Yep.
And this was the one where the reorganization, if you remember, was like off the charts, and Judy, like, and I think that was the whole discussion was, maybe there's things are reorganizing, and that's the furniture. Now the furniture is all coming back in the room.
That's exactly
Not only that, it's 2 standard deviations of norm. That's really a lot of change.
Yeah.
Over the next 6 months, which is wonderful to see.
Yeah. And this is the kid that is after this one. There was reports that he was, actually on his own voluntarily playing with other kids at recess, which hadn't really happened before.
Yeah.
They go from isolation or parallel play to interactive play.
Yeah.
It's
well, and it used to be about kind of his favorite topics. If he was going to, he would initiate by, asking people about what sort of operating system they had. But that wasn't everybody else's topic that they wanted to talk about.
Yeah, again, nice change in dominant frequency. Alpha got a little worse, but overall things moved towards the green. The beta improved. Nice.
Yeah.
Now here the hyperconnectivity got worse again. That's interesting.
Not by much, though.
Not by much, just nope. And I'm sure it's the ventral stream when we take a peek.
Nice.
Yeah.
Very nice.
Yeah, now that's not, everything's not green, but that's not what we're going for. You've got a whole standard deviation of change almost there with the delta and theta. I mean, that's pretty big change.
Right.
Yeah.
Yep.
And the beta came down.
Yep.
Yeah.
Got more relaxed. Look at the high beta came down and the beta.
Yeah.
Yeah, there's some of the improvement in dominant frequency. Maybe a little more anxiety.
Okay, stop there for a second. Let's just take a peek here. So we're getting a little bit of a relax flow better with him. That's really nice to see. So he can settle or a little teeny bit. not be in such a overdrive all the time.
Yeah. Yeah, I would say that was overdrive would be a good way to describe kind of how he has been in the world.
I've never seen so many people with that lateralization pattern. It's amazing.
Yeah.
And now you're making me think I'll go back through even more of the kids that have this diagnosis and see if we see that pattern of the lateralization pattern.
That's really interesting. That's so marked.
Wonder if they play ice hockey and get hit in the head by the puck.
Yeah.
Well, that would do it, Rodney. That would do it.
I brought maps of my first maps of two autistic girls. They were 11 twins, and one was yellow, yellow delta, yellow theta, and I didn't ask the right questions, and it turned out that she, as up to 2 years old, used to bang her head against the wall.
Yeah.
I didn't ask the right questions until I brought the maps here, because the contrast of it so stunned me. I thought, I'm bringing it to the webinar. Let's all talk about it. And, that was certainly the right answer. But they, right away, the other sister started talking after 3 sessions.
Wow.
That's
amazing.
Yeah. I mean, this is amazing technology.
Wow. I had one more set of maps to show you guys, but we probably won't have time to get through them all.
Yeah, you have a bunch. They're great.
Yeah.
They tell a really interesting story. Overall, you can see the reductions in delta and theta, and the majority, although there's some less, but all of them, we really see a big change in the coherence. And coherence has always been, a lot of coherence has always been a hallmark of kids on the spectrum. I'm interested, and anxiety is too. But what's interesting is how lateralized all these maps are.
Yeah.
But maybe it's a Canadian feature. Who knows?
How many more maps like this do you have, Cassandra?
I've got one more that I was going to show you guys today. I haven't looked at the lateralization. We can have a quick look if you like.
Well, I was just wondering if you had many more, several more, at least 2 or 3 more, if you wanted to do a part 2.
Yeah, sure.
I think it'd be fun because we're seeing all these similarities, and if we see a few more and we see these same patterns, I think that would be really quite helpful for all of us to take a peek at. So we could take a quick look, but if Richard and Judy are okay with it, I'd say let's schedule you for another night.
Sure, yeah, we can do that.
Yeah, that's great. And you're also seeing that a hallmark again is that the lack of connectivity and regulation between the temporal lobes and the and that generally that improves. Although we did have a case where the brain was it looked like it was getting less improved, but that's part of the cyclic iterations that brains sometimes have to go through. Coherence is an adaptive dimension. It's adapting to everything else that's going on. And when you see it change a lot in one direction more than it should, it's just the brain adapting.
Yeah.
It'll come back around.
Yeah. Well, I can certainly find you guys some more maps.
Yeah.
And
we'll see if we pick another neuro at night that you like.
Yeah. Cassandra, just send me some dates. Look at the one I send out every other day that has all the dates on it, and pick a date that's open that works for you, and we'll do part 2. I think it'd be great.
Great. Sounds good.
One of the things I'm hoping that we'll talk more about is with some of the older kids who are, say, pretty medicated to fit in, as the brain starts to improve, sometimes it's hard to talk to the families about going to the prescriber to talk about lessening the medicine. And I'm going through that now with a 23-year-old kid on the spectrum who's ticking as a result. I think there's so much improvement. I think it's his medication. And coincidentally, around the same time of the remap, the listserv, somebody wrote in about that. So I've had
medication can cause that ticking.
Yeah.
If they have too much medication and the system's normalizing, then they're over medicated.
You know, I've had people who have ended up, you know, where the kid has seemed over medicated, and there wasn't an issue with sort of working with the prescriber to drop it back. I haven't had that situation where people haven't been open to that. So
well, it might be just a difference in the medical system, you know, and the culture.
Yeah, it's actually the parents said to me, he's been on the same medicine at the same dose for all these years. He couldn't possibly be having, you know, a side effect now. And so trying to bring up their consciousness about why it might be. And that's what we're going for. You know, it's like they're having a hard time bringing that into their brain. Like, oh, so if the brain gets better, he doesn't need as much medicine.
Yeah.
You know, so it's interesting because they're very educated people, and yet it just does not compute.
Yeah, sometimes it's interesting that the parts that people hear and don't hear. I know I talk about possible side effects, and that would be that is a possible side effect of neurofeedback, is they don't need as much medication. So we usually have a discussion about that at the beginning. But people are all kind of wherever they're at in their journey of kind of understanding, and so we can certainly discuss more about that, though.
Yes.
Yeah,
next time.
That'd be great.
Yeah. Thank you to all three of you for your participating and looking at these maps and showing me some things that I didn't see in them. So thank you so much.
And back at you for your willingness to bring this.
Especially when it's a series of cases. This is cool.
Right, because if you have a couple of more of these asymmetry shifts like this,
I'll look for that now.
When Rob was saying, are there more, I was thinking about an article.
Write
an article on this because it's noteworthy.
Sure. Well, we'll see. I'll cull through I think we've got 150 in our maps. So we'll look and see if we've got others that, not all of them are on the autism spectrum, but I'll look through our other cases and see what other ones I could pull and see if we've got those same patterns. And I'll show you what we find next time.
Lovely.
Outstanding.
Well, thank you.
Thanks so much. This is where are we now? Like right about a little past the hour.
Right at the hour, yeah.
Time to wrap it up.
Yep. So we'll see you Wednesday, and just take note, it's on the list. We're going to take Memorial Day, which is Monday the 30th. Richard and Judy and I are going to take a little time off, and hope you will too.
Yeah. But we'll be
see
here
you Wednesday.
Next Monday.
Well, no, we'll see you Wednesday.
Next Monday is Victoria Day in Canada.
Oh.
Well, we may not see you then.
May not see you. All right. Good night, everybody.
Good night, everybody.
Good night. Thank you again.